Hi, this is Dr. Lindsay Remy. I wanted to talk to you a little bit about shoulder replacement surgery. There's two important types of shoulder replacement. The first is called an anatomic shoulder replacement. This is where the ball and socket are maintained as the way your shoulder was originally made, with the ball on the ball side and the socket on the socket side. This requires a working rotator cuff, which not everyone has. So for people that don't have a working rotator cuff, a reverse total shoulder or a reverse shoulder replacement is a better choice. This works through your deltoid muscle lifting your arm, and therefore the rotator cuff is no longer necessary. This, as you can see in the picture, is a ball on the socket side and a socket on the ball side. Most people go into shoulder replacement primarily because of arthritis between the ball and socket joint, but sometimes a reverse shoulder replacement is the best option for management of a really bad rotator cuff tear. If I don't think that there's a good chance of your rotator cuff healing and recovering enough for you to regain strength, then I may recommend a reverse shoulder replacement as the best path forward. There's one other reason some people may need a shoulder replacement, and that is certain types of shoulder bone fractures, where the pieces of the bones can't be put back together again properly. Those people also do best with a specific type of reverse shoulder replacement for fracture care. Well, the main goal is pain relief. By the time you get to severe shoulder arthritis, often your shoulder range of motion is restricted as a result. So most people after a shoulder replacement surgery do improve in their ability to reach overhead. But I try to make sure everyone understands that a replaced shoulder is not the shoulder of a 20-year-old. And for most people, they don't ever regain the ability to go 100% above their head beside their ear. The average shoulder range of motion after replacement is about 120 degrees, which would be about here. Now, some people do regain the ability to go all the way up overhead, and therefore sometimes can even return to sports such as swimming. But that's not a guarantee. No two people respond to any surgery the same, and I think it's important to understand that you may not regain all of the motion that you had when you were younger. There's another long-term restriction that I think people need to know about with shoulder replacements, and that's that we ask you not to lift heavy weights again. That's because one of the risks of shoulder replacement is the junction between the bone and the metal wiggling loose. If this happens, it can be a very hard problem to fix. And so we asked you to limit yourself to about 10 or 15 pound weights long term. Now that's still enough for most people to do household day-to-day activities and some sporting hobbies. But if your hobbies or daily activities include really heavy lifting, shoulder replacement may not be the best option for you. Shoulder replacement, like any major surgery, has important risks for you to know about. One of which is loosening, as I mentioned before. Another is instability, or the ball and socket becoming unhinged. That is more common in a reverse shoulder replacement compared to an anatomic shoulder replacement because you no longer have the rotator cuff providing that extra stability. Shoulder replacements can become infected, just like any other joint replacement, because the metal is unique. Your body cannot fight off an infection around a metal implant as well as it could in other situations. So infections of total joints are particularly devastating. These can happen either from your skin, while your skin is healing after surgery, or from your bloodstream, and therefore it's very important that we try to minimize any risk of bloodstream bacteria. So urinary tract infections, dental infections, toenail infections are all things that you want to try to avoid when you have a joint replacement. There are also risks of nerve damage to the arm, risks of bleeding, risks of medical complications such as extra stress to your heart or lungs or stroke. These are all scary things that we have to think about anytime you're walking into a major surgery. Thankfully, the risks of these are low, but I want you to know that we do everything we can to keep them as low as possible, but those risks are always going to be there. One of the unique risks of an anatomic shoulder replacement is that you could tear your rotator cuff in the future. and that then would make your arm difficult to raise. Some people with a functioning rotator cuff and bad shoulder arthritis may choose to go ahead and have a reverse replacement from the beginning so that they don't have to fear their rotator cuff tearing down the road. It's important that you optimize your health before surgery to minimize the risk of these medical things and surgical complications happening. For example, if you have diabetes, it's very important that your blood sugars are optimally controlled. My top ceiling for hemoglobin A1C before surgery is 7.5, but I encourage you to get it as low as you can possibly get it so that your blood sugars are really, really ideal in the weeks leading up to surgery and in the initial time of recovering. I also think that you can improve your healing after major surgery by making sure your body has all of the nutrients it needs. Particularly, having adequate protein is very important for your incision healing. We recommend 1 gram of protein per pound of ideal body weight to make sure your body has everything that it needs to heal up quickly. There's some role to strengthening ahead of surgery, but in the shoulder, it's more about your posture muscles than your actual shoulder joint. If you have bone-on-bone shoulder arthritis, you're probably not going to be able to work your shoulder a lot, but having enough strength in your legs, core, and the postural support muscles can make your recovery after surgery easier. One of your restrictions when you first get home from the surgery center after a shoulder replacement is you can't use your surgical arm to help yourself up from a chair, either pushing or pulling. So making sure now that you have the strength in your legs to get up without assistance is really important. That's all the tips I have for you today. I'll see you next time.